Good evening, everyone. It's Dr. Jen Freiheit here with the Kenosha County Division of Health for another weekly update with you. This week, or at the end of today, we are at 294 positive cases with another 139 probable cases. And those probables are the ones who have not been able to be tested, but they have all the right symptoms and maybe they had a close contact with a positive. So we count those and we quarantine and isolate those individuals as well. So it's been an extremely busy week. Our numbers are still rising, but our hospitals and our public health department are keeping up. I mean, we're strained, but we are able to manage and we are keeping up. So our hospitalization rate remains steady at around 18%. The state hospitalization rate for the entire state aggregate together is at 27%, and Kenosha County remains at a 2% fatality rate. So, but we are preparing for in case the worst case scenario, should things progress and get worse, we are looking at the Milwaukee Alternative Care Facility that has 529 rooms that you may have seen on the news. And so we would be able to refer people to that if necessary, if the hospitals do get overwhelmed. We are only testing 1% of the population at this time, and that is our mission critical this week, is to try to get more testing to the providers who are able to do that testing. Last Thursday, a health alert number 5 came out that basically stated testing can be done on anyone even with mild symptoms. And so it's a matter of getting collection kits in the hands of those who can run that testing. That was one of the questions I received today, in fact, was, has the testing criteria loosened? And in fact, it has, but are we having enough supplies? So another health alert number 6 came out today about how healthcare providers can get more supplies. The State Lab of Hygiene is able to produce that, and they're on a 24-hour turnaround right now, so they're keeping up. And the only thing is that it's not loosened all the way. People who are not showing symptoms are not able to be tested at this time, and nor can people use it as a return to work pass. So they can't just take a test in order to return to work. It's all based on the isolation or the quarantine order. As far as Abbott quick test, this is the one many people have asked about in the past. New news came out today that it does have a false negative rate of 14.8%. And I incorrectly spoke before that our Aurora system had this test, but they are not, in fact, using the Abbott quick test. They are using other quick tests that do meet the 95% reliability level. So we do not have the Abbott quick test in Kenosha County at this time. As far as PPE, personal protective equipment, this week, phase 3 of the Strategic National Stockpile shipment is coming to Kenosha County, and it will be distributed to 6 of our emergency medical service providers, 3 of our hospitals, and 7 of our long-term care and assisted living facilities. We are also distributing for everyone who is positive, who does not have a thermometer at their house, to be able to take their temperature twice a day, which is what we ask of them in order to monitor their signs and symptoms. We have distributed 216 thermometers out to people who are positive or probables, who we are putting in isolation and quarantine. And we're also distributing over 400 cloth masks and surgical masks out to family members of those who are isolating and quarantine. So we're literally doing a door drop for these people. And I just have to give a big shout out to Kenosha Cares and the many other individuals out there who are sewing up a storm, and they're donating cloth gowns, cloth masks for all of our facilities that need them. And the support has been amazing. So thank you, Kenosha Cares. Thank you, everyone out there who has been sewing and donating your handmade devices there. The other thing is that I received a question regarding what is an outbreak, or somebody coined it hotspot. And we are seeing several quote unquote outbreaks out there. Now, for the state of Wisconsin, what determines an outbreak? Well, An outbreak is simply one case of COVID-19 in a congregate, setting such as long-term care facilities. But for the rest, like businesses, it's 2 people that are positive with COVID-19. So it really only takes 2 people in one setting to be considered an outbreak. And we do have a few businesses that we have considered an outbreak by that very definition. Now, we are not publicizing those businesses. If the businesses would like to get out ahead of any rumors, we have certainly offered our services to do a joint press release or to help provide them with media talking points and that sort of thing. But we do not put out the names of those businesses unless they request our assistance to do that. But with that, I just would like you to know that we are reaching out to hundreds of businesses to help them with procuring PPE, to educating them on how they could better separate within their business space, their cubicles or their manufacturing line, talking about hand hygiene and cough etiquette and how to wear a mask and that sort of thing. So we have reached out and done this educational visit for over 208 businesses in Kenosha County, either by phone call, and for 16 of them, we've actually gone on site to do an assessment and help them. So we are providing an enormous amount of education to our businesses out there so that we can contain this pandemic. And so far, we are able to really have good communication with our businesses as long as we are able to receive, if there's a positive in a business, we ask basically for all of the people that might have been near that positive, so then we can call those individuals and educate them and tell them what it means to quarantine for 14 days and check their temperature and all of this sort of thing. So as long as businesses are able to cooperate with us, give us the names of all of the contacts that were close, we can definitely keep boxing in COVID-19 and keeping this under control. So that was an answer to one of the questions about outbreaks, or what the question was quoted as hotspots. Now, just some other random questions I have received and facts that I wanted to give out. Every Friday, there is a video that is put out called the FAQs, where the 10 most common questions of the week are answered, and that is put on several of our Facebook pages for the county and on the COVID-19 Hub webpage. And we have had over 13,600 views on those FAQ videos, reaching over 40,200 people. So that is really great news that our education message there is getting out. You might have also heard that pets have now been deemed they can get COVID-19. It had been suspected before, but now they have tested cats in New York City and a dog in Hong Kong. We really don't know too much about it yet, but so far we're seeing that pets are asymptomatic, or they may have respiratory distress and maybe some GI issues. So this is just a note to state that you might want to, when out walking your pets, is to not necessarily visit places where several pets can be running around together or that sort of thing. Then there's also another exciting update that I wanted to give is that the United Way COVID-19 Response Fund for Health and Human Service entities that are 501c3s, they have their grant. They met their grant goal of reaching $100,000, and the grant opportunity is open until this Friday for those 501c3s that want to apply. So we're very excited that the United Way is out there and being able to provide for those on the front lines, those health and human services entities that are fighting COVID. We also have a database through the State Health Department that's called Weaver, and that stands for the Wisconsin Emergency Assistance Volunteer Registry. Right now, Kenosha County has about 45 people on that registry. This is a database that people can go in to sign up if they want to be a volunteer in any emergency response, from flooding to fires to this COVID-19 response. And it's a way that people can put whatever their skills are, whether it's bilingual or they have any other special skills. It can be somebody who is retired or a student or anyone else. It does require the person to go through a background check. And so we are planning ahead, not that we necessarily need it right now, but just like we're planning with the alternative care facilities, we are looking for volunteers should the need arise that we need to pull upon. And having signed up through the Wisconsin Emergency Assistance Volunteer Registry is a good way to get your name on that list as well too. I'm also very happy to announce that 211 at Impact has been receiving several phone calls from Kenosha County. In fact, Kenosha County is the second highest county of usage in the entire state. So that does mean that our residents are really reaching out to 211 and hopefully getting their questions answered. And so we do want to encourage that all of our agencies within Kenosha County ensures that 211 is updated with the correct information, hours, contact, website, all of that on the 211 website to ensure that our residents can get the care that they need. And as I had mentioned several weeks ago, food still remains the highest need, people that are needing food assistance. And on to my last point is that we have talked about in the past flattening the curve, how we can flatten the curve. And we now have a good set of data to be able to pull from, to be able to put out projection modeling by the end of this week for Kenosha County. And this is really showing that the Safer at Home order over the last several weeks has worked. The public health tools that we put in place, such as social distancing and wearing a mask, has indeed helped to greatly decrease the number of people that could have potentially become ill or died in Kenosha County. So with this data now, we're able to look at what is trending and what we can then make better decisions based upon this projection modeling. You may have seen in the Badger bounce back how it's really relying on a 14-day view to see when our cases start coming back down. We're very eager to reopen, and we're eager to see that when cases do start decreasing, it does take 14 days to get that. You can't necessarily see after a day or two, if a number starts to dip, that we're on the downward slope. You have to be able to see over a bit of time. So not even 4 days or 5 days or 10 days. You have to be able to see after 14 days that we are indeed on the downward slope of that curve. But we're very eager to reopen, and we're working with all the other health departments in the state and especially in the southeastern region to begin to develop that blueprint for what that would mean with all of our mayors and county executive, and we are working diligently to begin to put some parameters on what that would mean to be able to reopen. It would come, as you might have heard the governor talk about, in a phased response. And I did have a question about that. What does that mean, a phased opening? And that could potentially mean that instead of, I'm going to use an example of the restaurant, a restaurant. It may not mean that a restaurant can open fully and go straight back to business as it was before COVID-19. It may have to be at a limited capacity. Several have put out a 25% capacity example to start off with, and you may see people like the waitresses and waiters and bartenders wearing masks. So it's a way to be able to begin to open up with still complying with some of these social distancing measures and all of the good hand hygiene, cough etiquette, and being able to slowly phase in that way as we begin to see some decline in our positive rates. So with that, I filtered in some of the questions that I had received, and I'm going to check my sources to see if I have any other questions as of right now. And it looks like there are no other questions for today. So I know that was a lot of information, and I appreciate all of your time, and there certainly will be much, much more information coming in the weeks ahead as we really start to be able to put some parameters, put some data together, put some rules and modeling together that we will continue to share with everyone. And thank you for your time. I appreciate this very much, and stay safe out there.